Without further ado, I think I'm going to let Charmaine take over here and just kind of have her enlighten us on the ins and outs of the body. So, okay, it's all yours.
Well, thank you, Dave. There's a lot more people than I was expecting. I'm not a teacher by any means, but I am very excited to kind of share my ins and outs, a little bit of tricks of the trade. I know people with the past experience have probably got tricks up their sleeves too, and I'm very grateful to have learned from several folks with great experience. So in my experience, it goes through various ranges in age, so it gives me a lot to kind of work with. So if there's anything specifically you want me to talk about, I would love to. Oldest patient I've ever drawn, about 106 years old.
Oh, wow.
Youngest.
Here in Whatcom County?
In Whatcom County, yes.
Wow.
So all ages, all body types present their own unique challenges and experiences. The youngest patient I ever drew was an 8-day-old baby, the back of the hand. She needed quite a bit of blood work for the size of the patient that I had, so that was kind of my moment. I was like, if I can draw her successfully, I think I can draw anybody. So that's kind of what keeps me going. It is harder to draw the little ones, but it's a great experience, really. To start, I want to kind of talk about how you will determine what kind of equipment you're going to be using. I know equipment is different from location to location. Different folks prefer different things and so on and so forth. So the way that I determine what kind of equipment I want is, first I want to know what tests they're doing, pretty much. That'll help me determine whether I need serum or plasma, how I'm going to process that, what kind of tubes I'm going to be using. And any kind of special handling, like protected, tapping it off and freezing it, refrigerated, that kind of thing. So that's what I'll start with. And then once I determine that, how much I need per tube also helps determine what kind of equipment I'm going to be using. Here we have your pretty much standard hub, vacutainer hub, and vacutainer needle. Regular needle you're poking into the body, and this end has a needle that has a rubber sheath over it. That's pretty standard. You're going to detach it and put it into the hub like so. This little pink thing, everything comes differently. The ones I'm used to have the actual safety attached to the hub itself. These have a safety lock on the needle. They're very handy because I believe Dave pointed out that he uses these mostly. This safety device is positioned so that you can still see the bevel of the needle going into the arm. So when you pull it, or when you know you're going to draw, you know it's going to be in the right position. You don't have to mess with it or turn the needle or anything like that. So that's extremely handy. And this is pretty much the basic go-to for almost anybody, unless you're assessing their arm and saying, whoa, this is not going to work. So after I select, or after I know what kind of tubes I'm going to be needing, serum separator, EDTA, they're color-coded based on the additive that's inside the tube. You can kind of see a mist that's in there. That is a clotting agent, so that helps the blood clot faster, so that you can spin it down and then they test off of the liquid portion of the blood. So when you do let it clot and you spin it down at a high velocity for 10 minutes, this serum, or the separator gel will separate the liquid portion of the blood, and the cells will be underneath it, so that separates it, and it won't be remixed if you shake it or if it gets dropped or whatnot. And that's what they test off of. The EDTA, it's pretty much almost the same volume. It's sprayed on the inside. That's an anti-clotting agent, so that makes it so that the blood doesn't clot. These are highly used for like CBCs, so on and so forth, to make sure those cells don't clump together so they can get a proper count off of those. If you were to spin this down, you would have plasma instead of serum on top. It is possible to remix it, so that's something that you need to keep in mind also. So those are basic. I mean, you have a huge rainbow of different things that you can, yes.
I was just going to ask, you talked about the different tubes. So if I'm concerned about the order of draw, how do I know what the order of draw is on something?
It's going to be, I don't have a chart with me to show you, but if you have blood cultures to do, those would be the very first. I remember it as tubes that have more of the additive inside of them are going to go first. That's how I memorize it. But the blood cultures, blue tops, those have a very large amount of anti-clotting agent in them. And you can actually see it being moved and stuff, so that's like prothrombin times, any kind of anticoagulation studies, stuff like that. The order of draw is based off of what additive can or cannot be possibly contaminating the next one. So the more additive, the higher possibility that it could contaminate the next containers. So you would draw a serum separator tube first, and then the lavender, because you want anything that needs to clot in here. If you were to draw it the opposite way, it's still a possibility that it'll be fine, but it is a higher chance that you'll get something that's going to cause this to not clot. And especially with needles that don't have a sheath on them, or if you're using an wind infusion set, which I don't have an example of, they don't. That's it. I'm just saying for the difference between the devices that are going to lessen the chance of a cross-contamination of additives. If you're using that kind of setting, some folks, which I wouldn't recommend, they do use just the needle and transfer it into the actual tube. That's a high possibility of cross-contamination of additives. This way there's not as much of a chance because it has that sheath on the needle on the inside. And also if you're going to the correct order of draw, if there's somewhat of cross-contamination, you'll still be fine. Yeah. Did that answer your question?
Yeah, well, I kind of knew for myself, but I know like some of the students,
Right.
they might, it's important to know that draw, because if you don't get it right,
Right.
it's wrong. Labs won't like you to get it.
Like you to get it wrong.
Yeah. Yeah, there are most facilities. It is most protocol to have an order of draw. Just for a quick reference, it's usually to the left or the right. Oh, yeah. There are some tests that are highly sensitive, so you can't even draw anything before them. Oh, thank you. Beautiful wind infusion set. Yes. These are very, very fun for hard draw. Anything that comes out of the back of hand, I have a very large vein, so I would use a 21 or a 23, depending on what you have and how comfortable you are using it. Just like a
21 or 23 gauge.
gauge, yes. This is a 21. Check that out. That's pretty cool.
Ooh, to be excited about.
I know.
Yeah.
Well, I love my equipment, so that's how I choose my. Beautiful. And the ones I'm used to working with actually have a safety lock on them. You just push a button and it pulls the needle into the device. That can cause a little discomfort if you do it too fast, or if the patient is, if the patient is extremely dehydrated, it almost has a sucking feel to it as it comes out, or there's resistance when it comes out. It's not smooth as butter. And so there is a trick to the ones that have that automatic. You just keep this finger behind it as you push the button, and it slows it down a lot faster. And most people don't feel it that way. Not putting pressure on the needle as it comes out. That's another thing to reduce possibility of pain. I've noticed that even on myself. My coworker drawing my blood, they push down and then pull out, and that causes a lot of pain. I was like, oh my goodness, I'm not going to do that, So a successful draw for me is Gritting, yeah, one sick.
I'm sorry.
Yeah.
Most people,
That to me is successful.
very basic. You want to get it all the blood you need, all in one poke with little to no pain. And it is a possibility to poke somebody with a very sharp object and not cause pain. So that's my personal gold star there is, oh, I didn't feel anything. Oh, you're already done? Oh, you already poked me? I'm like, that's amazing right there. Or even children who, they're going to get worked up because they don't understand really what's going on, and it's a sharp object. They associate it with shots. You getting something shoved in your muscle is going to hurt a lot more than in a sharp needle into a vein. And they know, I get it, it's a foreign object going into your body, it's sharp, you associate with that with pain, but yeah, back on topic here. Yes, choosing the correct equipment. My vein, I don't know if you can all see that little blue bump right there, that's a nice vein.
Yeah, mine are
Beautiful and juicy, yes. And that's not, that may sound weird to people who aren't in the profession, but it's a big, beautiful, juicy vein.
Yes.
This is kind of, it gets boring drawing these all day long. It's nice when you're starting out and you're not quite confident of yourself. You're less likely to miss that or go through it or so on and so forth. But it's nice seeing these if you're having a bad day. Okay. Finally, an easy patient. Okay. That would be the next step in choosing the correct equipment after finding out what your minimums are, minimum volumes on the tubes, what tube you want, and what order of draw you need. The next, choosing your equipment, I would use the largest needle I got on this vein. And pretty much the largest we use is 21. No, 22. 21, yeah. Basically because I can see it, and I've been trained to rely on feel over sight. If I can see it but I can't feel it, that's far more nerve-wracking than vice versa, to me. Because I can't rely on it not going flat. A lot of times that may mean they're not going to be able to hold the, stand up to the pressure of the pole. Because these, if you're just using your standard, I mean obviously this has no air in it, so when you puncture it, it creates a vacuum. You can't control how hard it's pulling on the vein when you use this setup. So if you're not sure that if you can see it, if you can see the big old blue mark there, but you can't feel it, which I can without a tourniquet, but if you couldn't feel it, I'd be concerned that it would be pulling too hard and it might go flat. That might compromise the sample. That's the biggest thing, is you want a successful sample. You don't want it to hemolyze, which is crushing blood cells, popping all that. You can't test on that. And the devices they're testing with, they're almost fully automated. So you can't have somebody kind of, guessing or making an estimate on it. It's a very sensitive machine that, a little bit of hemolyzation, it is still possible. So if it's a really, really hard draw and you're just like, I can't get any more, this is all I got, and I don't know if it's hemolyzed, send it anyway. There is a possibility stuff or a test can be completed on them. It's just, fuck the person so many times and they're like, just send it. We're done. We're done. There's only so much you can do. So this vein, yes, this is the setup I would be using. If I were to need to do back of the hand, I would use, depending on the size of the vein, a 23 or 21 gauged infusion set and a syringe. The syringe is really going to lessen the pull on the vein. It's going to lessen the chance of hemolyzation, extreme pain, and it is a little bit more to work with, equipment-wise. But you would be attaching, pretty much you would be taking off the sheath needle and attaching it to the syringe. I usually hold it in my left hand. I'm a righty, but I feel with my left it's extremely sensitive. So if I were to ever injure my pointer finger, I'd be out of a job. It would not go well, let's just say that. I have the syringe in my hand, I'm feeling, get it in there. Okay, I love the stability of these butterflies. They're very, very handy, especially when you have multiple tubes. They're even handy, the larger gauges of butterflies are very handy for multiple draws, multiple tubes. My record is 2 sets of blood cultures and 26 individual tubes.
Wow.
Out of one person in one setting. And for adults, that's, she was a very sick person. She was very sick.
How long did that take?
Not a lot. She had a very large vein like mine, which is another thank you. You see all the tubes you need. You get it. Yes.
How did you do that with the tourniquet only being on a maximum of a minute?
Well, the maximum can be 2 minutes, but you obviously don't want it on that long. She had such a large vein that it went extremely fast. That is another thing you keep in mind. The length of time you can keep that on. So I set it up, make sure that I have everything lined up. That'll lessen the fumble, lessen the in and out, and get that tourniquet off a lot faster. For patients who are extremely hard to draw, it is something to keep in mind, but that pressure, if you take it off, the vein's gonna go flat. And it's kind of a, go with your best judgment based on what you have to work with, because every arm is absolutely different. There are, you have your AC up the middle, and then you have all the other veins, and they're not perfect, they're not the same. So it's always best judgment based on experience in the field and what equipment you have to work with. So if you're really down on what, your choices, go with the best you can. I have had several patients that I couldn't. The vein kept going flat, even when I did have the tourniquet on. So if I were to undo that, I'd completely lose it and I'd have to poke them again. You try to go by the book, but it's hard to go. But it did not compromise the sample at that point, because I was not pulling severely hard on the vein. I had a very small needle, and I was pulling just as much as needed to keep it going, pretty much. If it wasn't moving at all, and I wasn't getting anything, that's an indication that you just need to stop, because you are gonna compromise the sample that you already have. So that's one thing to think about too. There are a few instances where I've actually popped that off and it started flowing again. And so the vein, you can't see microscopically, so you don't really know why some things work for some people and some don't. But the tourniquet is a huge tool in cementing your choice of veins, your locations, and what you feel, and the equipment that you are going to choose. So that's why I love the syringe. The winged infusion set with a larger bore needle, my record patient with the most, she had a great big vein. I could pop the tourniquet off, but it was going so fast that I didn't feel it would be on there too long to compromise the sample. And I had a vacutainer hub on this instead of so it was pretty much like so. And with the winged infusion set, and if it's somewhere in the middle, or if it's not in an area that's going to dangle, obviously, it's not safe to let go of your needle ever. But when you're in the situation, and there's so many tubes that it kind of has to be. We don't usually carry tape to tape it on there and whatnot in case there's somebody who faints, or somebody who freaks out and pulls it out, or stuff like that, which has happened. I don't usually let go unless I'm doing that, and if I am going to let go, I still keep a finger or a hand on the patient. I always have some kind of, that way I can feel them moving before I see them if it's going to happen. I can feel their skin if they're getting really cold and really clammy. That's okay, we're done.
Yeah.
Pretty much.
The bigger they are, the harder they fall.
Why would you choose to use the winged infusion set over just the regular vacutainer needle? Especially when you said she had a really good vein. Why did you do that?
She had 26 tubes and 2 sets of blood cultures to draw. that's a lot of instability, that's a lot of movement, in and out, in and out, in and out. My personal rule is if it's 4 or more tubes, I will be using the correct size needle for the size of vein, but I will be using the winged infusion set for stability's sake, for their safety. Because if you're constantly pulling it out, pulling it in, pulling it out, there's that possibility of going deeper and or pulling it completely out. A lot of the newbies do that too because they just don't have that feel yet of how much pull it takes to pull the needle or pull the tube off and to keep it stable. And I know some people are a little, they're a little afraid to touch the person. So and it's me, I get in there.
They used a syringe with it, right? Is that what you did?
For my record, for the 26 tubes, I used a vacuum hub attached to a larger board infusion set. That way I could keep it in the vein, hold on to my person so I didn't extend this past its point. Because if you do that, boop, pop, the needle comes. It's real fun, real fun. Excitement in the lab. But I'm holding the tube, I'm holding the hub, and I'm changing it like this. This, because this is my dominant hand, I use most of it for stability's sake. And your other hand becomes very dexterous. For feel, even just a light bump on the skin, a light stroke, you can kind of, because if you go in a lot deeper, thicker folks sometimes, not all the time. This is extremely close to the surface, it feels like, but if you palpate a lot heavier, you can definitely tell it's very, very round. You're palpating across it to get the right size. And I want to visualize where I'm going, but I also want to palpate below and above it to determine the direction of the vein. And that also helps me figure out which way I'm going to be stable when I'm drawing. Yeah.
Thank you.
Yeah, no problem. Any other questions at this point? Okay. Yeah. So, tests, tubes, equipment. Where else should I go with this?
You want to do a demo?
A demo, sure.
I have a question.
Yes.
What was your most difficult?
Most difficult. That's a good question. There's different challenges in everybody. I find that extremely elderly folks present kind of a medium difficulty. Their skin is very papery. There's not a whole lot of tissues, fascia holding that skin down to the actual muscles surrounding the veins. A lot of their veins are just kind of sitting on top. And so you can kind of, it feels like a wet noodle just being pushed around. And it's very, very hard to anchor. And it's a lot easier to go through them or glance off of them.
And are they quite often dehydrated? Just because of their age and their possible condition why they need to have them?
Yes. Their health obviously is a huge thing. The hydration level, the way they're made, and so on and so forth. That's a huge thing where you're anchoring the vein above, and I do below also. My fingers are usually at an angle so I don't have them in the way of the needle. There's different ways.
Choice.
I haven't been poked yet, so that's great. But most difficult, I would say, are children because they don't understand why you're doing this. And yes.
Do you have any like special techniques? We're working in our pediatric stuff in our text right now. Do you recommend any like before techniques when working with children? Like obviously you don't want to lie to them and tell them it's not going to hurt, but do you take the time to try to explain, or are you just so task-oriented you just want to get in and get out?
You know, I've definitely noticed the difference in my coworkers and their techniques. Me being a big softie, I want to become their best friend, but I know that there's a professionalism you have to keep to and to get your job done. Most pediatric patients, they respond well when you treat them with respect. I mean, most adults, they don't want to be talked to like a child. Children want to feel like you're talking straight to them, not over them. and I'm not a child expert, but this is what I've noticed, that some kids, they like it when you explain what's gonna happen, so it's not as scary. Some children, they want you to be their best friend, you know, and engage in what interests them. So it's kind of, yes.
I usually do work in the lab sometimes, and what's your advice for when a patient barely even enters the lab, it's already like, oh my goodness, freaking out. You barely touch her to just put the tourniquet on and they're already like jumping. What's your advice for that?
Desensitize them to it as best as possible. Respect them by saying, I totally understand that this is really nerve-wracking. And some people, they have previous experiences that are causing them to completely blow up or take things out of proportion. But working with animals myself in my spare time, horses are very sensitive to crazy, weird things. And I've noticed that desensitizing humans to touch, you know, sometimes people are, they're fluttering around and they're not really, it just makes things, you know, more nervous the more nervous you are. You know, I'm normally, I touch them, I say, okay, I'm just touching at this moment, okay, let's just get used to that first. And then we're gonna get into a squeeze. It's a little uncomfortable, that's gonna be mostly, you know, the scariest part is that in people, more nervous folks who are afraid to touch their patient, or flittering around, that personally makes me more nervous. It's like, okay, you're nervous, you don't want to touch me, you don't want to screw up, but you don't want to touch me, and it's just, that makes me more nervous, the more nervous, you know, so I just try to be as confident and not overpowering. I'm a presence, I'm physically a presence, but I try not to be overpowering with any age. I have a lot of experience with different people passing out and having nerve issues and whatnot, and children cussing and spitting and puking and kicking and pulling hair and yeah, all kinds of stuff like that. But the best you can do is